Hi everybody, my name is Adriana Delgadillo and I'm going to be talking to you guys about hand hygiene today. So the average person has around 1,500 species of bacteria on their hands. Every single time we touch something like the doors or our car handle or car door handles, just about everything we come in contact with has different bacteria and viruses on it. So these viruses are not always bad, but some of them can be very harmful to our health and well-being. Depending on where you've been during the day, like work or who you've been hanging out with, the viruses on your hands could harbor the flu virus or something called the norovirus. So the norovirus causes viral gastroenteritis that can spread rapidly. So that is like the tummy flu. It's very easy for these germs and viruses to make their way to our mouths and noses when we touch faces or what we eat throughout the day. So what is the simple and most effective way to prevent the spread of infection is proper hand hygiene. So today we'll be discussing the difference between hand sanitizer and regular soap and water with the antimicrobial hand washing soap, why it's effective against infections, and the 5 moments of hand hygiene. So the 2 different ways that can prevent the spread of infection is using hand sanitizer and of course the hand soap. According to the CDC, which is the Center for Disease Control, hand sanitizers are effective, but not as effective as regular hand soap and water. Hand sanitizers do not fully eliminate the germs on your hands that are heavily soiled from daily activities. One of the reasons they are not fully effective is because people actually don't use them properly. So if we don't use them properly, then they don't work. They don't kill all the germs on our hands. The CDC does recommend that if regular soap and water is not available, then we should use the hand sanitizers available, which are available at all of our desks, because those actually still kill about 60% of all the viruses on our hands. The proper way for hand sanitizer is to rub the product all over our hands and make sure it is fully dry. If it is not fully dry, then sometimes if we touch something else, it gets rubbed off and the germs are still on our hands. But of course, washing hands with soap and water is the most effective way. Washing with soap and water can prevent diarrhea, skin, eye, and the respiratory infections. In the medical field, we're touching patients all day. So when we call a patient from the waiting room into our office and our space, those germs of the patient are now transferred into our private work area. So if the patient is sick and we're not properly cleaning with the disinfectant wipes that are provided, like the Sandy wipes, then those germs are spread to our area, or maybe if we touch our clothes, our face, our mouth, our eyes, now those are viruses that are on us, and we even can take those home to our families and our kids. Germs are very easily spread. So according to the CDC, proper hand washing reduces the number of people who get sick with diarrhea by 23 to 40%, reduces diarrheal illness in people with weakened immune systems by 58%, reduces respiratory illnesses like colds in the general population by 16 to 21%. Also in the hospital, we have nosocomial infections, which are hospital-acquired infections. About 1 in 10 people admitted to the hospital will actually acquire an HAI, which is a hospital-acquired infection. Those include pneumonia, UTIs, which are the urinary tract infections, meningitis, surgical infections, gastroenteritis, and more. They're also associated with significant morbidity, mortality, and hospital costs. These germs are spread through person-to-person contact. Unclean hands that touch the machines, hospital tools, catheters, and all the hospital devices are directly spread to the patient and the patient's surroundings. The doctors, nurses, medical assistants, and all the medical personnel who are taking care of these patients day in and day out really need to make sure that they are reducing the spread of infection by washing their hands. It is safe to say how crucial hand hygiene is at reducing the spread of germs. The World Health Organization has 5 simple ways to reduce the spread of infection. These are the 5 moments of hand hygiene. So one is before touching a patient, before clean aseptic procedure, after body fluid exposure, after touching a patient, and after touching a patient's surroundings. This direct approach is recommended for healthcare workers to clean their hands. It makes it really simple and covers all areas of when to practice proper hygiene, hand hygiene, because these germs and viruses can live on our hands for hours if not cleaned properly. In conclusion, proper hand hygiene is very crucial in the prevention of germs and viruses. Hand washing with soap and water is the main way, but of course, like I stated, that the hand sanitizers are still available, and that kills at least 60%. So we must remember the basic rules, which is the 5 moments for hand hygiene. These simple steps have a great impact on reducing the spread of undesirable germs and viruses. Thank you.